The government has provided additionally 110,000 smartphones for use by the promoters and community health assistants. The shift from curative to preventive health will further be strengthened by the promotive services provided by community health promoters at the household units and integration of preventive services at the primary health care level. These services will include screening for hypertension, diabetes, and high conditions, offer the necessary health education on water and sanitation, nutrition, and provide community rehabilitation services, among others. These services will be provided through multidisciplinary teams that will be established at the level of the primary care networks. To strengthen the legal basis for health financing, health service provision, and achievement of UHC, 4 new health laws, which I signed into law yesterday, have been enacted. These are the Community Health Insurance Act 2023, Primary Health Care Act 2023, Facility Improvement Act 2023, and Digital Health Act 2023. Health insurance coverage in Kenya is generally low at about 26%, with those at the bottom of the economic pyramid having the least coverage at only 5%. Many Kenyans incur catastrophic expenditure from out-of-pocket healthcare payments, while many more do not seek care at all when they fall ill because they simply cannot afford it. Over the last decade, several measures have been put in place to enhance the capacity of the National Hospital Insurance Fund to effectively deliver on its mandate. While these reforms and the initiatives therein have yielded significant progress, several gains and several gaps remain. Recent analyses show that, among others, the NHIF operates as a passive rather than a strategic purchaser of healthcare. It is plagued by inefficiency and governance challenges and is potentially, unless addressed, financially unsustainable. It is against this backdrop that the government proposes a paradigm shift in the provision of social health insurance in the new Social Health Insurance Act 2023 that provides for formation of a social health authority which will repeal the current National Hospital Insurance Fund Act 1998. In our plan, I promise a fully publicly financed primary health care system, an emergency care fund, and a health insurance fund that will cover all Kenyans. This promise is delivered through the enactment of the new Social Health Insurance Act, which, among others, establishes the publicly financed primary health care fund, a fully publicly financed chronic and emergency and critical illness fund, and the social health insurance fund, and access to health care from now henceforth will no longer be based on ability to pay. It will be based on the health needs of every Kenyan. We are implementing a per-household payment system where a flat rate applies to everyone, regardless of their income. Consider this, for example. Previously, an individual earning 10,000 had to pay Kenya shillings 500 for NHIF, a hefty 5% of their earnings. On the other hand, those with a salary of 100,000 or more contributed 1,700, a mere 1.7% of their income. Astonishingly, even someone with monthly income of Kenya shillings 1 million, like William Ruto, the president, paid the same amount of 1,700, which translates to a paltry 0.17% of their substantial earnings. This bizarre setup meant that low-income earners, mama mbogas and bodabodas, were effectively subsidizing high-income earners like myself. The Social Insurance Fund corrects this anomaly and makes sure that every citizen pays for health a percentage of their income, an equal percentage of their income, so that we can equalize the fortunes of every citizen with respect to access to health. The Social Health Insurance Fund also signifies a shift to increased use of domestic resources for health financing and a sustainable approach, especially at a time when resources from donors and development partners are dwindling.